you feel like every meal is a gamble. One day your stomach is calm, the next you're bloated, doubled over in pain, or frantically searching for the nearest bathroom. If that sounds familiar, you're not alone. That's the daily roller coaster of living with irritable bowel syndrome, or IBS, a condition that affects up to 10% of the population. And while IBS is not life-threatening, it is definitely life-disrupting. It affects your energy, your mood, your social life, and even what you dare to eat. Most people with IBS are left guessing. Was it the dairy, the salad, the bread? So naturally, many turn to diet changes hoping for relief. But with all these different plans out there, low sugar, gluten-free, dairy-free, low carb, it's easy to feel overwhelmed, confused, and frustrated. So you may have tried everything and still feel stuck. And that's why this new study is so important. Researchers compared 11 of the most popular diets used to manage IBS, and they found which ones actually work best based on real clinical outcomes. And the diet that ranked number one, it may not be the one you've heard the most about. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. IBS is one of the most common digestive conditions seen in clinics, and it often gets brushed off as just stress. But in reality, it's a complex condition with multiple triggers, especially when it comes to food. The hallmark symptoms: bloating, abdominal pain, constipation, diarrhea, or in many cases alternating between the latter two. Many people also experience fatigue, brain fog, and anxiety due to this gut-brain connection. What makes IBS so difficult is that it doesn't look the same in every person, and that's why diet plays such a crucial role, not just in managing symptoms, but also in identifying what your unique body needs. So what did this major study actually show? The link for this article is in the description, so you can see that. So researchers reviewed 28 randomized clinical trials totaling more than 2,300 patients to compare the impact of different diets on IBS symptoms. These weren't casual food blogs. These were scientific studies evaluating some of the most commonly recommended diets, things like starch and sucrose reduced, lactose-free, Mediterranean, low FODMAP diet, and personalized plans. And I will go in a minute what FODMAP stands for. The surprising and maybe, I guess, not so surprising finding of this research: the starch and sucrose reduced diet ranked number one for improving overall IBS symptoms. In plain terms, people who cut back on refined starches and added sugars felt significantly better. They had fewer flare-ups, less pain, less bloating, and better quality of life. This approach outperformed many others, including some that are far more complicated. Now, one of the most widely known diets for IBS is the low FODMAP diet. And yes, it still performed well in this analysis, but what exactly is FODMAP? FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are types of short-chain carbohydrates found in many everyday foods like onions, garlic, apples, milk, beans, and certain sweeteners. In people with IBS, these carbs often aren't absorbed well in the small intestine. Instead, they move into the colon where they ferment, causing gas, bloating, cramping, and urgency. The low FODMAP diet works by temporarily removing these foods, allowing your gut to calm down, and then gradually reintroducing them to figure out which ones are triggering symptoms. In this study, the low FODMAP diet ranked fourth overall, but still showed strong benefits, especially for reducing abdominal bloating. From a functional medicine perspective, this actually makes a lot of sense. Refined starches and added sugars are known to feed harmful gut bacteria and, of course, increase inflammation, especially when the gut lining is already compromised. Reducing them can help rebalance the gut microbiome and reduce symptoms. It also suggests that for many people, Simpler interventions like removing sugar and starch may be just as effective or even more sustainable than very complicated elimination diet. Of course, no two people with IBS are the same, and that's why personalization is the key. In our clinic, we often use gut stool testing, food sensitivity panels, and metabolic markers to guide these personalized plans that actually work, not just temporarily, but long-term. So what is the bottom line? The starch and sucrose-reduced diet came out on top for improving overall IBS symptoms. The low FODMAP diet was still very helpful, especially for bloating, but ranked slightly lower overall. Other diets, like the Mediterranean or lactose-free diet, showed mild benefits but didn't outperform the top two. No one-size-fits-all solution exists, but evidence-based options now give us more clarity than ever. And that's empowering because with the right strategy and support, you don't have to live in fear of food anymore. If this video helped you in understanding the symptoms of IBS, please give it a like, share it with someone you care about, and subscribe to the channel. Thank you so much for watching. Until next time. Bye-bye.